Can you tell me your name and your date of birth, please? Okay, and do you have any allergies we need to know about? Okay, and then I'm looking around the room for safety risks and I don't see any. Okay, so the doctor has ordered a nasogastric tube to give your stomach some relief. So that's just a tube that goes in your nose, down to your stomach to get rid of some of that excess fluid in your stomach. Okay, so I have all of my supplies ready right here. I wash my hands. I'm going to put on my gloves. And then my patient, it looks like they're already positioned in an upright sitting position. So we are going to keep them that way. And I'm going to measure this from their nostril to their earlobe, and from their earlobe down to the xiphoid process, which is about 50. So we'll go ahead and mark this with some tape just as a reference. Okay, and I'm going to go ahead and place this on their lap just because they may or may not gag, and then I'm going to place this in there because some fluid might come out of it. Okay, so we're going to go ahead and lube this with our lube, and then we're going to go in one nostril. I'm going to have them tilt their head back while when going in, hold the back of their head, and then go in until you reach the back of the throat, and then have them put their chin down to their chest and take a drink of water and swallow to get that in the right place, okay? And it's not going to go as far on the mannequin because it just won't go as far in. Okay, so we've reached that. So now, while stabilizing it, I am going to tape it. Tape this to their nose. Gonna wrap this around here just to ensure stability. Okay, and I'll make sure that they're not choking or anything, because if they are choking and they can't breathe, then it might be in their airway. So you might check the back of their throat to make sure it's not coiled in the back of the throat. And once some gastric contents are coming out of this, before you hook up suction or irrigate it, you want to make sure that you test the pH of the fluid that's coming out of there to ensure that the placement is correct. And so this is in here, and then this little blue tube right here is a vent just to get rid of air that might be in the stomach. And so we'll want to come back and assess them as needed, and then also you want to make sure that where this placement and tape and everything is, you want to make sure that that it's not like causing issues on their skin or anything. And so then I'd pin this to their gown. Take this away and pin this to their gown. And then once placement is ensured, we'll go ahead and hook this up to suction, which I don't have my adapter with me, but if I did, I would hook this up to suction. And then I'm going to take my gloves off and wash my hands. Okay, and now we've checked placement and we've ensured that it's correct, so I'm going to wash my hands again and put my gloves on. And then we have 30 milliliters of saline here, and we're going to clamp the tube, unhook the suction, and then we're going to clamp the suction, unhook it, then get the tube, and we're going to put this in there, the saline in there to flush it. Then we're going to take it out and we're going to hook it back up to suction. And then you want to make sure that you document on the fluid that's coming out of it how much, the characteristics of it, like the clarity, the color, and things like that. And then I would take my gloves off, and then I'll wash my hands. And now we're going to take the tube out. So I'm going to enter the room, explain to the patient, okay, like we don't need that tube anymore. We're gonna go ahead and remove it. The doctor said it's okay for us to remove it. So I'm gonna wash my hands. I'm gonna put my gloves on. Okay. And then I'm going to clamp the tube so we don't get gastric contents everywhere. We're going to drape a towel over the patient's chest just so they don't get fluid everywhere. And then I'm going to go ahead, I would go ahead and put this here too. I know we don't have to do that. And then I'm going to lay this in there after I've clamped it and unhooked it from suction and clamped the suction. And then we're going to go ahead and flush this. And then we're going to disconnect it. So the tape is the hardest part of this. You want to try to be very gentle and make sure to keep the tube stable. So I'm just gonna remove it like this since I'm having a hard time getting it off. And then we're gonna make sure just tell them to take a deep breath and hold it, and then you'll pull it out. And then you'll discard it as needed per hospital policy. You will provide oral care and nose care as needed. And you'll want to make sure that you assess where this tape has been on the patient's skin. Sorry, I'm having a lot of trouble trying to get this off here. There we go. And you want to be gentle taking it off of there. And then you'll want to do the right documentation of the discontinuation of the NG tube, and you will monitor the patient periodically. I will now take my gloves off and I will wash my hands.